Hello, my name is Jackie James, and today we're going to look at the renal system and do a little quiz to test your knowledge. So, questions. Question 1, which structures make up the renal system? Urethra, uterus, bladder, kidneys, ureters, bladder, kidneys, urethra, penis, bladder, blood, urine. This sort of multiple choice question is quite common with lots of examining bodies. So they will have two of the items which are in the system, and then they'll put one that's in a different system. So it's really the easiest way to answer these is to look for the questions or the areas of the body that aren't in the system we're talking about. All through this quiz, if you need more time, please press pause on the video. So I'm going to move to the next question. So this is a labelling question. A lot of awarding bodies actually give you the names. So if you don't need to remember how to spell the items. So if we look at this diagram here, if you think A is the kidneys, then you would put an A next to number 3. Again, we're going to, if you need more time, please press pause. Which of the following are functions of the renal system? Forming urine and regulation of blood pressure, control of salts in the body and adding water to the body, control the pH of blood and removing metabolic waste, production of erythropoietin, and controls the physical composition of body fluids. Looking at any question like this, normally there's one or two that you know are wrong. So that will just leave you your choice of the right one from what's left. Question 7, what is the function of the renal pelvis of the kidneys? Does it produce urine, transport urine to the ureters, produce the hormone erythropoietin, process metabolic waste? Question 8. The kidneys are composed of a cuticle, cortex, medulla, and matrix. Calces, medulla, renal pelvis, and cortex. Ureters, urethra, bladder, and medulla. Renal pelvis, ileum, humerus, and pubis. Again, you might look at this quiz and be able to identify things that are definitely not in the renal system or not in the kidneys. Question 9. Ureters are 30 centimetres long and pass urine from the bladder to the kidneys, 10 centimetres long and connect the bladder to the kidneys, 10 centimetres long and connect the bladder to the urethra, 30 centimetres long and pass urine from the kidneys to the bladder. Question 10. Which statement is true? Kidneys are inferior to the bladder. Urethra is superior to the ureters. Bladder is superior to the kidneys. Kidneys are superior to the bladder. So this question is really testing your understanding of the terms inferior and superior. Question 11. The internal urethral sphincter is located at the top of the bladder, at the base of the bladder, at the base of the kidneys, at the distal end of the urethra. Question 12. The external urethral sphincter is located at the top of the bladder, at the base of the bladder, at the base of the kidneys, at the distal end of the urethra. Question 13. Is the urethra longer in men, women? Is it the same length in both sexes, or women don't have a urethra? Question 14. Where in the kidneys is urine produced? Is it the nephrons, tubules, cortex, or renal pelvis? Question 15. Where in the kidneys is any excess water reabsorbed so that it's not excreted? Nephrons, tubules, cortex, renal pelvis. Question 16. When the kidneys reabsorb water so that too much water is not excreted, the process used is phagocytis, active transport, osmosis, or diffusion. Urine contains blood, sulfuric acid, urea, and minerals, or uric acid, plasma, alcohol, and steroids, urea, salts, water, bilirubin, uric acid, hydrochloric acid, urea, salts. Question 18. Urea is produced by breakdown of bile from the liver, breakdown of proteins and amino acids, breakdown of iron in the blood. It's a naturally forming product in the body, so it is not produced. So how is urea produced? Question 19. Uric acid is produced during the breakdown of purines, which are found in seafood, offal, alcohol, and formed by your body. A high uric acid level can lead to diabetes, gout, haemophilia, allergies. Most awarding bodies won't give you a question on conditions. They will assess that separately, but I was running out of questions here for the renal system. This is one of the more simpler systems. Question 20. Which organ controls blood pressure? The heart, the spleen, the pancreas, or the kidneys? Right, let's go through the answers. Which structures make up the renal system? The kidneys, the ureters, and the bladder. If you look at all of the other options, they've got something in there that is not in the renal system. Answers 2 to 5. So if we start with A is the kidneys is question 3. B, that is the ureter, which goes from the kidneys to the bladder. C is the bladder. And D is the urethra. So that is what goes from the bladder to the outside world. When you have diagrams like this, or you're likely to get diagrams like this in your exam, it's really, really helpful if you can actually draw a little really simple diagram yourself on some note paper, and that will help you get things in the right order. Which of the following are functions of the renal system? And it forms urine and regulates blood pressure. So the functions are, if we look at all of the functions, they're producing urine, production of erythropoietin, which controls the formation of red blood cells, regulates blood pressure, controls the balance of water, salt, and potassium in the body, and controls the pH or acidity of the blood. What is the function of the renal pelvis of the kidneys? It transports urine to the ureters. Answer 8, the kidneys are composed of B. All of the others have got things that are not in the kidneys. So that's just giving you a description of part of the kidneys. Answer 9. Ureters are 30 centimeters long, pass urine from the kidneys to the bladder. If you think about it, the kidneys are fairly high up in your body, and your bladder is near the base of your torso. And we've got them on the diagram there. Answer 10, the kidneys are superior to the bladder. All that means is the kidneys are above the bladder. So anything above is superior, anything below is inferior. The internal urethral sphincter is located at the base of the bladder. And the external urethral sphincter is located at the distal end, so the far end of the urethra. So this is the sphincter that controls when you release urine from the urethra. Is the urethra longer in men or women? Well, it's men, definitely. Where in the kidneys is urine produced? In the nephrons, answer A. And where in the kidneys is any excess water reabsorbed so that it's not excreted? And answer B is the tubules. When the kidneys absorb water, they use osmosis. And in here, there's just a reminder of those other terms. And answer 17, urine contains urea, salts, water, bilirubin, and uric acid. So if we look at healthy urine, it's a clear yellow fluid. And this little chart says, if you've got a dark urine, you need to increase your fluid, and if you have a sort of greeny brown, you need to seek medical attention. Answer 18, urea is produced by the breakdown of proteins and amino acids. Answer 19, uric acid or too much uric acid in your body can lead to gout. And as I said before, most awarding bodies don't include a question. They don't include the pathologies with the anatomy, but I was running out of questions. Question 20, which organ controls blood pressure? And it's actually the kidneys, because that controls how much water to take out of the blood or how much water to leave in the blood. So that's the end of the presentation. I hope that was useful.